Hi, my name is Becca Story. I'm a graduate student at Georgia Tech, and I'm presenting a portion of the research that my colleagues and I conducted on how the experience of childhood psychological maltreatment is related to work-family conflict throughout adulthood. Most of the work-family conflict literature focuses on how dynamic factors drive fluctuations in work-family conflict. However, recent studies suggest that people actually have a relatively set stable point for work-family conflict that can be explained by individual differences, and this is referred to as trait work-family conflict. To examine how trait work-family conflict is established, we used Life Course's stress framework as well as attachment theory to explore how childhood psychological maltreatment predicts the availability of personal resources, such as sense of control, and also social resources, such as spousal support, which are associated with reduced work-family conflict throughout adulthood. We chose to look at childhood psychological maltreatment specifically because children who experience psychological maltreatment are at an increased risk for developing insecure attachment styles and can hold a negative view of themselves and their relationship with others. We chose to use archival data in order to test our hypotheses and use path analysis to examine how childhood psychological maltreatment is indirectly associated with work-to-family conflict and family-to-work conflict through increases in perceived constraint and decreases in personal mastery and spousal support. What we found is that the experience of childhood psychological maltreatment was negatively associated with personal mastery and spousal support and positively associated with perceived constraint and family-to-work conflict. However, our tests of the indirect effects were not significant. There are several reasons that we believe contributed to a lack of significant indirect effects. Firstly, in our path analysis, all mediators were tested simultaneously, meaning that the covariance that each mediator shared with work-to-family conflict and family-to-work conflict overlapped with the covariance that it shared with other mediators and work-to-family conflict and family-to-work conflict. These overlapping covariances resulted in smaller effects. Secondly, our sample was fairly young. 1/3 of the sample had no children, and the remaining participants may have had only one child. There's evidence that the experience of parenting a child can trigger a person's memories of past maltreatment, and so the ADD health participants may not have had enough family demands to trigger those kinds of memories, leading to an underreporting of maltreatment. Altogether, these findings add to the recent literature surrounding trait work-family conflict and indicate that childhood psychological maltreatment is associated with the availability of personal and social resources necessary for managing work and family roles.